In the heartland of America, veterans who once fought our battles overseas now face a different kind of battle at home, a battle for proper health care. The words "deny until they die" have chillingly become synonymous with the Veterans Community Care Program, a system devised to offer timely health care but now mired in bureaucratic sluggishness and fatal neglect. It's a crisis that not only shatters trust but also lives, demanding an immediate and uncompromising reform. The U.S. Department of Veterans Affairs, VA, was entrusted with a noble task to care for those who have served. Yet, recent investigations by the Office of Inspector General, OIG, and intense scrutiny by the Senate Committee on Veterans Affairs reveal a troubling picture of oversight failures and systemic inefficiencies that have left many veterans out in the cold, literally and figuratively. The Community Care Network was established with a vision of efficiency and accessibility for our veterans seeking health care. Envisioned as a beacon of timely medical assistance, the reality, unfortunately, starkly contrasts the initial promises. What was supposed to be a solution has become part of a larger problem, a system wrapped in red tape, leaving many veterans stranded on long wait lists. This introduction sets the stage for a deeper dive into a system plagued by oversight failures and inefficiency, outlining the crucial need for a thorough examination and subsequent reform. The Office of Inspector General's damning reports have illuminated a stark reality. The VA's oversight of the Community Care Network contracts is fundamentally flawed. This lack of effective oversight has led to a cascade of inefficiencies affecting the quality and timeliness of veteran care. These oversight failures are not just administrative errors, they are breaches of trust that endanger the health and lives of veterans. As we peel back the layers, it becomes evident that systemic changes are imperative to restore this trust and ensure the health of our veterans. The Senate Committee on Veterans Affairs has not been silent on these issues. In recent hearings, figures like Senators John Tester, Sherrod Brown, and Angus King have voiced significant concerns and demanded accountability. Their involvement underscores the gravity of the situation and signals a legislative push towards substantial reforms. This part of the essay will explore the dynamics of these Senate hearings and the pivotal role they play in shaping the future of veterans' health care. Ironically, the Community Care Program, designed to cut through bureaucratic red tape, has become ensnared in just that. Veterans face a paradox where the promise of accessible health care is countered by an unwieldy system that often delays or denies care altogether. Through specific examples, this section will illustrate how bureaucratic hurdles are not just inconveniences, but potentially life-threatening obstacles for veterans relying on this system. Every delay has a human story behind it. This part of the essay will share poignant stories of veterans whose health deteriorated while trapped in the waiting game enforced by the community care system. These are not just delays, they are denials of the care and respect owed to those who have served. These narratives underline the urgent need for reform, as each story sheds light on the human cost of administrative failure. TriWest and Optum, the third-party administrators supposed to facilitate the Community Care Network, have come under intense scrutiny. Tasked with managing provider networks and ensuring timely care, their performance has fallen short of their responsibilities, stirring controversy and criticism. This section will critically assess their role and the implications of their performance on the overall effectiveness of the Community Care Program. Recently, the use of VA resources originally intended for veteran care in managing the migrant crisis has sparked a heated debate. This controversy touches on sensitive issues of resource allocation and priority, raising questions about the fairness and focus of VA policies. We will delve into the complexities of this issue, exploring the implications for veterans and the overall integrity of the VA's mission. In response to mounting criticism, the VA has made several public statements aiming to clarify its position and actions regarding the various issues plaguing the Community Care Program. This section will analyze these responses, weighing their adequacy and sincerity against the backdrop of the ongoing crisis. Understanding the VA's stance is crucial for assessing the potential for real change within the system. The Senate Veterans Affairs Committee has been unequivocal in its demand for immediate improvements. This part of the essay will outline the specific actions and reforms proposed by the committee, emphasizing the necessity for swift implementation to prevent further harm to our veterans. The urgency conveyed by these calls reflects the critical nature of the reforms needed to overhaul the community care system. As we look to the future, there is both hope and a clear path toward reforming the community care system. This section will discuss potential legislative and administrative changes that could reshape the system into the efficient and responsive network it was meant to be. The focus will be on realistic and impactful reforms that can make a significant difference in the lives of veterans. This crisis in veterans' healthcare is more than a policy failure. It's a moral one. Our veterans deserve better, and it's time for all stakeholders, legislators, administrators, and the public to rally for significant reforms. This conclusion will serve as a call to action, urging an uncompromised commitment to overhauling the community care system. The path forward is fraught with challenges, but the stakes are too high to accept anything less than complete dedication to resolving this crisis.